So, sir, with your initiative, you bring a glimmer of hope to the people who are hopeless.
I would rather say it's a design problem, right? So, the design of healthcare is something that's slightly skewed.
Do you think that better medical service is an intentional problem rather than an access problem?
The Indian healthcare story has been built on is a story of scarcity. Every time you speak of healthcare to anyone, you will hear the same issues that we don't have enough doctors, we don't have enough beds, we don't have enough hospitals. That is really not the case if you see it from my lens. Message to the younger people of today is don't really get fixated on the big cities or the big companies or the big organization.
Shuchin sir, in your answer, I like the point where you said that a responsive patient is one who is mindful of what he is eating outside in the streets.
Yeah.
And the answer of most of the problems are in the kitchen. Sir,
Absolutely, yeah. Your kitchen is your pharmacy. And most of the people I talk to, my patients, I think my message to the young Shuchin is complete your studies. Don't drop out. Because it was a spur of the moment decision, but I still feel that.
Welcome viewers from India and the globe. Today we have with us Dr. Shuchin Bajaj. Welcome sir. Today we will learn about you, and I urge everyone to learn about the story, support you, and do something reasonable. Or is the person who is the latest association is in the Unreasonable Business Impact Society, and we will try to bring meaningful change to the people near. Sir, welcome to the podcast.
Thank you very much. Thank you very much for your kind words. I am sure I don't deserve half of them, but I'll take those compliments very graciously and with deep thanks. I'm really happy to be on this podcast and really happy to be talking to your wide global audience, which is truly a privilege for me.
Sir, I think you have chosen impact over income. You have chosen, I think, scale over comfort, and you have chosen service over status. Sir, tell us something about the work you are doing with Ujala Cygnus Healthcare Services.
So, I strongly believe that your healthcare destiny should not be dependent on the pin code you live in or the money you have in your pocket. So, I have devoted all my life to making sure that we dissociate access to high quality healthcare from your financial, social, or geographical backgrounds. If you have a heart attack in a town like Kethal, you should not be forced to drive 2 hours, 3 hours away to Chandigarh or Delhi in a critical situation. You should have access there. Or if you have a heart attack in a big city like Delhi and you don't have any money in your pocket, it should not mean that you don't get the best quality healthcare. Or if you are a woman or from a unprivileged class, it should not mean that you are deprived of high quality access to healthcare. So financial and geographical, most people understand that, okay, if you are stuck in a small town with a critical illness, it will be difficult for you. If you have no money in your pocket, it will be difficult for you. Social is very difficult to understand, and most people don't even realize it till we call it out. We have seen many women patients coming to hospitals and with 2 or 3 gram hemoglobin, bleeding, with a dye handle delivery, and fully complicated, and we tell them, the patient's relatives, that okay, she needs a surgery, she needs blood transfusion, she needs very intensive critical care to make sure that she survives. and the family then suddenly comes up and says, no, this is too much, we will not be able to spend so much time and money, in this much amount we will get a new wife. So the care denied to people who are not really at the forefront of society is something that is quite under the radar, and we all need to make sure that that is not the case. So any person living anywhere with any means should have access to very high quality healthcare is something that I truly believe in.
So, sir, with your initiative, you bring a glimmer of hope to the people who are hopeless. And that brings me to the question that do you think that better medical service is an intentional problem rather than an access problem?
I would rather say it's a design problem, right? So the design of healthcare is something that's slightly skewed. What the Indian healthcare story has been built on is a story of scarcity. You know, every time you speak of healthcare to anyone, you will hear the same issues that we don't have enough doctors, we don't have enough beds, we don't have enough hospitals. That is really not the case if you see it from my lens. If we don't have enough hospitals, doctors, or beds, why are most private hospitals that you see, you get published results of all listed healthcare companies, you can go and see the numbers of any hospital company. Even the best hospitals will have occupancy levels of 60, 70, 80%. Still, there are 20% beds vacant. On the other side, we have public hospitals where you don't get a date for a surgery for 6 months, 8 months, 2 years, right? So it's not that we are only having limited number of hospitals. It is a design issue where hospitals and doctors are concentrated in some urban areas. So almost 75% of Indian doctors live in the top 20 cities, where you have less than 25% of population of the country. So rest 25% doctors are catering to 75% of the population of the country, where it is very difficult to find a good quality doctor, or it is very difficult to find affordable healthcare. So this design that is skewed towards big cities and large urban conglomerates has to be spread out to more people. We have to democratize access to healthcare. We have to flip the traditional private healthcare model, which has traditionally been a very low volume, very high cost model, into a very high volume, very low cost model. How can we flip it is something that's not really very thought through by most people. What we are trying to do is the same in our hospitals, that we try to do low cost work and build high volumes out of it and offer them very high quality. So this is something that we are trying to do and change the design of healthcare delivery completely to make sure that we can offer it to as many people as possible.
So, sir, let's hear it out in a bit detail that how your organization fits in here and how it is democratizing the access of better healthcare to the next door for everyone here.
So what we are doing, I think, to get the true context of it, let me go back a little and say why this organization was started. Right. So I come from a family which came to the country as refugees during partition. So they had lost everything. My father used to, in his very early days, used to live in a horse stable, actual horse stable that he used to live in outside of a Haveli on Idgah Road, which is a very prominent area of Delhi if you go, the old Delhi area. So there was this Haveli where, various rooms were there. So a lot of families lived in that. So my father's family got a horse stable outside the Haveli allotted. So 15 people used to live in that horse stable together. And my father used to make kites for a living early on in his life. But the problem was that they could never earn enough money selling those kites to subside, to really feel that they were doing okay. So my father decided very early on that education was the way he would climb out of poverty. many people decided different things. Somebody said I'll do business, somebody said I'll try and do a government job. There were various paths available. My father said I will educate myself to make sure that I climb out of poverty. So, but he literally had to climb out because 15 people in one room, he couldn't really study there, right? All day he was busy making kites, and at night, if he tried to study, the rest of the people would, scold him that, shut that lamp, we are trying to sleep. And more importantly, if that lamp makes the kites catch fire, then we won't have anything to eat for a week. So what he did was he literally climbed out of the horse stable. Since it was a stable, there was no staircase, etc., to go to the roof. So he hung a rope from the roof and used to climb up that roof and stay and go and study on the roof. And he lived there for many years. So he made a makeshift house for himself out of tarpaulin, etc., because Eidgah Road is very close to the Old Delhi railway station. So they used to have cargo coming in. So from that cargo, he took some tarpaulin sheet, some rope, something, and he made a makeshift, hut kind of a place for himself. And he stayed there for a very long time. And he used to climb up the rope every day. He got married there. My sister was born there. So they used to climb up the rope, study there, and this is what he taught all of us as children, that you have to study. His favorite line was that if you want a roof on your head instead of under your feet like I had, you better study. Otherwise, you'll be very poor and you will not be able to climb out of poverty. So this is how our family was in the initial days, right? And we were always made to realize this, that money is something very precious, because he had seen life without any money at all, right? When he had come to India, there was no money at all. I remember we were 3 siblings, my sister, my brother, and I. And one day he put us in a line and scolded us for, I think, almost 30-40 minutes continuously, because the electricity bill for that month had come to more than 100 rupees. She was like, you are irresponsible children, you don't shut off the light, you don't shut off the fan when it is not needed, and how can you have this, who's going to pay this 100 rupee electricity bill? So all these things taught us that value of money was something that most people did not realize. So luckily I got into a government medical college, and in India the government is very generous if you can clear those exams, because I remember almost 15-20 lakh people used to appear in that PMT exam that we used to call it. Luckily I got a good rank, so I got into a government medical college. My annual fees was 413 rupees, I still remember. So luckily became a doctor. I was allowed to study, I had enough time, and my fees was not much. So I did my MBBS, did my MD, then became a doctor, came back to Delhi, and now I was the doctor in the family, right? So now people would call me that somebody's had a heart attack, somebody's very sick, we are bringing them to Delhi, can you help them? Sometimes they wouldn't reach because distances were so much. In a critical disease, you sometimes don't make it. So one particular week 2 patients did not make it, and I was studying to be a gastroenterologist in Delhi, and I was like, there are already 20,000 doctors in Delhi, what will one more make a difference? They all have to travel to Delhi to access healthcare, and they don't make it. So what they really need is healthcare which is close to their home, right? That is where it is needed. Second was because we had been taught the importance of money a lot. I saw that it was actually very expensive to take healthcare in Delhi. And one particular conversation completely blew my mind. When I went to one of the villages to attend this funeral of a family member, so they were all sitting together talking, and one old man was saying that, अरे अच्छा ही हुआ ये रास्ते में मर गया, कोई बात नहीं, जो पिछला वाला हमारे गांव से गया था दिल्ली, वो तो 15 दिन वहाँ एक अस्पताल में रहा, उसका घर भी बिक गया, खेत भी बिक गए, और अब देखो फिर मरा वो, तो उसकी देखो विधवा तो भीख मांगती है, सड़क पे बच्चे भी भीख मांग रहे हैं, कम से कम इस परिवार के पास कुछ तो है, घर तो बच गया इनका. So sitting in this room listening to this podcast, everyone would say, no, we'll do anything to save a patient, a family member, do anything at all. But here was this pragmatic old man who said, boss, एक आदमी को बचाने का कोई ज़्यादा फायदा नहीं है अगर पूरा परिवार उसकी वजह से मर जाता है. So financial outcomes were as important to this community as physical outcomes. They realized that one person will drag down an entire generation with them. And you do have these statistics in India, right? Almost 6 crore people, 60 million people slip below the poverty line every year in India just due to one healthcare shock. So your family, your generations have to bear that cost of illness. It is not just you. So then I realized that having them closer is also important, but having it cheaper is also very important. You have to be affordable as well as accessible. You can't just have one. So this is how it all started, right? This is how we. So of course, none of my family was very happy with this because my father had built his whole, ethos on education, that you have to study, study, study. And here I was dropping out of super specialty course like gastroenterology, which was great in demand. And my father was, तुम्हारा दिमाग खराब हो गया है, करोड़ों रुपए में सीट खरीदते हैं लोग, ये तुम्हें फ्री में मिल गई इसलिए तुम अप्रिशिएट नहीं कर रहे हो, और ये उल्टी गंगा क्या बहा रहे हो, लोग छोटे शहर से बड़े शहर में आते हैं, तुम यहाँ बड़े शहर में हो, तुम उल्टा वापस जा रहे हो, ये क्या चक्कर है, ये कौन करता है, nobody does that. It took a lot of explaining for me to make sure that he understood, but he stopped speaking to me for 2-3 years. He would not speak to me. And I remember clearly the day he restarted speaking to me was when one of his elderly cousins had a massive heart attack in a town called Panipat, and we had built a hospital there, and we had a heart center there. So his son took him to another hospital. They said, no, he's very serious. You have to take him to Delhi. He's a big heart attack. So he started going towards Delhi at night. And then when he had just started, he remembered that, Shuchin had told somebody they have a hospital there. And then he called me, took my number from someone and called me. Said, do you have a heart center also in that hospital that you have in Panipat? I said, yeah. Do you have a cardiologist? I said, yes. So then he turned around. And in the middle of the night came to the hospital. I had already called the cardiologist during that time, so cardiologist was waiting for him. And when he entered our emergency room, his father was clinically dead. There was no sign of life. So they cardioverted him. Shock lagate na, revived him, took him to the cath lab. He had a blockage, cleared that blockage, and he survived. And then he called my father that your son has saved my life. So then my father was like, maybe you are doing something right. He was such a strict father. So it is a difficult thing to do, and if you are doing this, then it is very clear in your mind why are you doing this, right? Because everybody is saying you are doing a stupid thing. It has never worked. Why would you go to a small town? Everybody comes to big cities. बिग सिटी में ही बनाओ, यहीं पे पैसा है, यहीं पे डॉक्टर हैं, यहीं पे इंफ्रास्ट्रक्चर है, और यही चल रहा है कई सालों से ना. अगर आप बिल्कुल अगेंस्ट द ग्रेन जा रहे हो, तो then it is not really about the money, it is not really about fame or power, it is about something that you have seen that it is a problem and you should try and solve it.
It is more of a purpose.
Yeah. So once you have that, then I think things are very clear on what you want to do, how you want to do it, and you keep doing it again and again.
Sir, thank you very much for sharing this inspiring story, and it somehow is the difficult situation through which your father came to India, made his own life, and supported all of you to become who you wanted to be. And somehow it also shows the kind of discipline and dedication he wanted from his child, because he asked for the proof of work, which we talk about nowadays. Sir, in this particular journey, what is the message you want to give to youth of today? Because if I learn from this story, the situations were in dire, difficult situations through which your father went through. And what I see in you is you, even after having access to everything, access to the best medical studies, access to the best city, the capital of India, you never forgot the pain of the common people, and you decided that I should do something for them. First, I should learn, and then I should help the common people out. Nowadays, we see people having all the privileges and not thinking like this. So, what will be your message to a young Shuchin or any young boy or girl of our country or the globe who is starting with all the privileges? How he should make his career and make an impact, sir?
I think my message to the young Shuchin is complete your studies. Don't drop out, because yeah, it was a spur of the moment decision. But yeah, I still feel that if I had finished my gastroenterology and then started it maybe 2 years later, I don't know if I would have been able to start it. The longer you wait, sometimes the
Yes, yes.
decisions look more and more, difficult to do. So yeah, maybe it was the right time to decide. But I think the main message to the younger people of today is don't really get fixated on the big cities or the big companies or the big organizations. There is a huge market lying outside of this, right? Outside of the top 20 cities, if you are able to identify a problem that really needs to be fixed, identify the problem first, and then start talking to the people what their problem is, how they see it, and then only develop solutions to it. Don't see a problem, develop a solution, and then fall in love with it, and then say कि अरे ये तो मेरा solution इतना बढ़िया मैंने बनाया कोई ले ही नहीं रहा है, which many people I've seen doing it, right? There are a huge number of people who've developed these fancy electronic medical records, hospital management systems, high technology for doctors, and then they come to me and say अरे सर हमने तो इतना बढ़िया बनाया, doctors don't take it, they are not really smart enough. So I tell them doctors are the smartest people in the room, right? They have always been toppers in their class. That is why they became doctors. So you can't say that they are not smart enough. Your solution maybe is not the right solution for them. For example, see, if you see a young girl crossing a street in heavy rain, getting all wet, poor girl, what do you think she needs? Most people hearing this podcast would say she needs an umbrella, right? Now the problem is you have now developed this solution for her, and now you are in love with this solution that she needs an umbrella now. You will go and give her an umbrella. Now your variety of solutions is from here to here only, because now what can you do her maximum? If she refuses your umbrella, you will think, okay, she doesn't like a blue umbrella, let me give her a pink umbrella, black umbrella, orange umbrella. Oh, she doesn't take all of them, then maybe she likes a foldable umbrella or a long umbrella. Now you're fixated on that, and she will always keep refusing कि मुझे नहीं चाहिए boss. And then you will say she is stupid, इतना बढ़िया मैंने solution दिया कि आप बच जाओगे बारिश से, मेरा solution लिया ही नहीं इन्होंने, she is not good enough. You have to go one step back. The solution she needs is not really an umbrella. The solution she needs is to cross that street without getting wet. Now, if you have that in mind, now your variety of solutions goes from here to here. 100 रुपए का अम्ब्रेला नहीं है तो 50 पैसे का पॉलिथीन दे दो उसको, वो ढक लेगी, क्या पता उसके पास 50 ही पैसे. Or maybe she's too rich, or she's saying I don't want to hold the umbrella, I need somebody to hold the umbrella for me, or I need a Rolls Royce to cross the street, or I need a covered pathway built for me. So your solution goes from 100 to 500 rupees to now a 50 paise to a 5 crore rupee solution, right? Whatever she needs, she can take it. But you have to ask. And this is now, most people would know, this is called as design thinking, right? In my time, I didn't know that. But I got lucky enough that I went and talked to the villagers. I sat with them because they were my family. Otherwise, if people were not able to come to Delhi and dying on the way, my umbrella solution would have been bring them faster. We need better ambulances, we need better roads, we need green corridors. But that was not what they actually needed. They were saying maybe it's good that he didn't reach Delhi. Maybe it's good he died on the way. The solution was very different. Pulling them to Delhi was not really the solution. So, to the young people, don't fall in love with your solutions. Talk to the user as much as possible. Develop 5 6 solutions, offer them those solutions, build a minimum viable product, offer it to them, then see what they use, what they don't use. What they don't use, you have to discard, because they are very smart people. Your user is the smartest people. You can't, say that they are not
Fool
intelligent
the
enough.
user. Yes.
So उनको पहले दिखाइए, उनसे यूज कराइए. If they use it, then it is a product worth pursuing. So go to the smaller towns, go outside the big cities, and develop solutions for problems that they are facing today. There's a huge market there. So it is not just that fact that you will do good for them, you will do good for yourself also, because you will build a business that is sustainable, that can make you earn money. So you will be both market minded and mission driven, right? Just being mission driven will not allow you to scale, will not allow you to survive for a long time, because you will always need grants or aid, and in this environment it's very difficult to get that. Being only purely market minded will never give you the satisfaction or the access to rural communities or underserved communities. Then you are only in the big city. But if you are both market minded and mission driven, then you can actually offer it to 5 billion people across the world. That is the untapped market. It's a multi-trillion-dollar market that's just waiting for these types of solutions, because pure capitalism, pure market only actually serves the top 1 billion people appropriately. In India, if you see, healthcare, mostly people would say it is too expensive. Even rich people having good jobs, good employment, they will come and tell you, sir, बहुत महंगा हो गया hospital जाना, तो it's scary for us, right? So it's only the top 1 billion that can actually comfortably go and say, हाँ जो मर्जी करिए. And pure charity model only serves the bottom 1 billion comfortably, because as an employee or as a person who's holding a good job, you wouldn't like to wait for 6 months to get a surgery done, right? So that is not something that you would go for. You would go for something that's in the middle, that okay, I wait for 3 days, but I get the surgery done at an affordable price. I don't want to pay 10 lakh rupees for a surgery. So this is something that's really very, very good for both the community as well as the entrepreneur, if you can develop a model like this.
Sir, with your answer and in you, I am seeing the light of knowledge, because what you depicted right now is medical services are more of cause, calling, and purpose rather than a pure business sense. So, sir, if you want to say something on that.
Yeah, so absolutely it is. See, the problem is sometimes people will say, oh, this doctor is very, money minded, or, they are here only to earn money. But don't see the doctor right now, right? He is not become a doctor suddenly out of the thin air that, आज आए और doctor बन गए और आज पैसे कमाने बैठ गए. See this child when she was in 8th or 9th class. That is when she decided that I will become a doctor, right? That is when she started studying towards that I want to be a doctor. After 10th, she took that branch that okay, I want physics, chemistry, biology, and I will study that. She has put in effort from 8th or 9th class, when all of her friends were out playing. When they became older, they were out partying, they were attending the relatives' weddings, etc. She was studying. Then when she went to medical college, 12 or 13 years, bare minimum, you are studying there. And believe me when I say this, any other branch does not have to study even 10% of what a doctor has to study. During my MD days, I remember I read 5 books only for ECG. I remember this funny story. We went to our professor to seek his blessings for our MD exam, that sir, tomorrow is our exam, and please guide us something or tell us something that will make it easier. He said, yeah, I'll give you a mantra and you will never fail. I said, boss, paper leak hone wala lag raha hai. So he went inside, brought out 6 thick, like these thick books, and he gave it to us. कि बेटा ये अगर तुमने पढ़ ली ना, कोई फेल नहीं कर सकता. I was like, कल सुबह है सर एग्जाम. ये 6 नई किताबें अब आप दे रहे हो. So people have to study a lot to be a doctor. Any other branch, you see, you go to a lawyer or a engineer, you tell them your problem. They will say, okay, I've understood your case. Now come back in 2 weeks. I will research on it. I will study it. I will prepare something, and then we can discuss. Right? Can you ever imagine you going to a doctor and a doctor saying this to you that come back in 2 weeks, I will research, study, and then tell you what your problem is? You will say,
No.
doctor kuch aata hi nahi hai.
Yes.
He has to make a decision like this. You tell your symptoms and she will sit there and diagnose you and then say, okay, we'll do these tests, but this is what I am feeling is something wrong with you. So they have to deal with thousands of diseases, hundreds of thousands of humans on a real-time basis.
And instant solution is needed.
Instant solution is needed. You have to tell the patient that this is what I feel is something. If you say, no, come back in 2 weeks, I have to study what is wrong with you, the patient will never come back to you. Patient will say, no, doctor kuch nahi aata. So imagine the doctor during those days, when they were in school, when they were in college, when they were doing their MD, when they were appearing for entrances in which 2 million, 3 million children are appearing, 20 lakh, 30 lakh people are appearing for NEET, and out of that, you have only 15, 20,000 getting government college seats. So the competition is huge and they are truly dedicated to it. Now, if they come out and they are treating you, we have to remember that Indian healthcare is still amongst the cheapest in the world, anywhere. And it is truly the best because it is on demand. You want to see a neurosurgeon today, you can see a neurosurgeon today. If you want a robotic surgery tomorrow, you can actually get a robotic surgery done tomorrow. Doesn't happen anywhere else in the world. Anywhere else in the world, you won't even get to talk to the doctor, right? You will never have their numbers, never have their access. Here, everything is accessible and at a fraction of the price. So, it is truly a purpose-driven industry. See, in every industry, you will get some bad apples. In healthcare also, I am sure there are some people who are not at all suitable for it, who have completely changed their priorities, they want only money. But I truly feel in my heart they are a very tiny minority. Most of the doctors really want to do well for their patients, they want their patients to get well, and that's a vast majority. If you are a student right now, and if you are not prepared to put that hard work of 15, 20 years into this, it is not the right branch for you. It is truly not a branch where you can earn a lot of money compared to the effort you put in. If you put in so much effort, continuous 20 years in any other industry, you will earn much more. So it is truly a purpose-driven industry, and young people who are listening to this, if you are looking to become a doctor, be prepared that there is a lot of hard work involved in this.
Sir, this brings me to power of intention. And sir, you have wore a number of hats. And if we can say now, my question will put you into a different spot where you are working as an administrator as well. I want to ask you, sir, that being a cause-driven, service-oriented medical doctor and administrator now in a trust deficit society, how does that feel?
It is quite unfortunate because, see, this trust deficit, what is the reason for it? It is again the design that we have put in healthcare, right? Now, if you see what happens in US, the number of lawsuits against doctors there is the maximum in the world. Do you think those doctors in the US are making more errors than the doctors in Europe? Are they more corrupt than doctors in Europe? It is all Western, which is, you feel the Western part of the world is very highly advanced in medical science. In Europe, why are there no lawsuits? In India, there is so much violence against doctors, physical violence, right? You hear every day that some patient was beaten up, some doctor was beaten up in a hospital. Why is this? So, in the US, it is legal violence. That you are suing the doctor, you are taking them to court. In India, it is physical violence. You are not suing the doctor, but you are beating them up. This is it is actually exactly the same. It is just the violence.
Light.
Yeah, it is just the violence is different because in the US, people trust, I think, the justice system more. That they know that if we beat this doctor up, we will be in jail for sure. But if we drag him to court, we will get a decision in say 6 months, 8 months, 1 year. We will sue this doctor and earn, get him penalized. In India, it's the opposite side that people don't trust the justice system so much. They say if we take them to court, it will be like 20 years, and our generations will keep fighting the court case. There will be no decision. It is such a long process. But if we beat him up right now, we'll take care of the issue right here, and we will not be arrested, because if they then put a case against us, that is also a 20-year process. So this violence is the same. It is just what people are preferring according to the system they are living. But in Europe, why is it not there? Because the design of the healthcare system is different. In US and India, it is a fee-for-service system. That you go to a doctor, you pay the fees. You go to a hospital, you pay the surgery charge, room charge, etc. And then it is an episodic kind of a care. In Europe, it is more of a subscription system where doctors are on fixed salary. You are paying a monthly subscription, and when you get sick, you go and get treated, and you don't need to pay anything there, or the doctor doesn't earn anything extra. Now this drives trust, because healthcare is such a difficult subject to understand, right? As I said, you study for 15-20 years, even then you make errors. So it's very difficult for a non-medical person to understand. And the balance of power in information is hugely skewed towards doctors. See, you go to a hospital with pain in your chest. Now it may be acidity, it may be a heart attack, it may be a pneumonia, lung disease, you don't know. You've gone there saying, I am having some discomfort in the chest. Now if the doctor says this is a big heart attack, now if you move from here, you will die. Just lie down and we'll put a stent in. That is the only way to save you, right? Now, if you see that the doctor is actually earning money out of putting that stent in, right now you have no choice. You say, marna to nahi hai, to karana hi padega.
Yes.
But you feel irritated and wronged that I have no power on this decision now. Because the doctor has all the power. They are saying, karna hi hai boss, marna mar jaoge aap, theek hai ji, marna to nahi hai, kar do. Now, if you see the doctor earning money out of this, you say, boss, ये शायद पैसे के लिए किया होगा, मुझे तो कुछ समझ आया नहीं. But if the doctor is not earning any money out of that, it is not a fee-for-service institution, then say उसने अच्छे के लिए किया होगा. That is the whole system issue. That is where trust deficit comes in. Now, if something goes wrong during that, then you get very angry because पैसे के लिए किया और मेरा मरीज भी मार दिया. देखो पैसे कमाने के लिए सब गड़बड़ के मारो इसको. लेकिन अगर वो पैसे नहीं कमा रहा था डॉक्टर, तो आपको लगेगा यार गलती हो गई. सो यू विल अज्यूम अ मिस्टेक if the doctor is not earning, but you will assume malice if the doctor was earning money out of this. So this trust deficit is actually because our healthcare model as a design is fee for service, which again I personally feel that obviously very difficult to implement, and we run hospitals which are fee for service. But as a design, according to me, education and healthcare should never be fee for service. They should always be available, accessible to every person, regardless of whether they are able to pay or not pay, and highest quality. You should not have that, okay, I will send my child to a private school which is high quality because I can afford more money. My colleague who drives me cannot afford money, so he will send his children to a worse school. That is not going to bring generations up the ladder in the future, right? Similarly, healthcare, me and my colleague who drives me around should be able to access the same care of health, because money should not determine your PIN code, should not determine your healthcare destiny. So this is why the trust deficit is there. It is a sad thing, but yeah, the design we have to change to solve for that. It's a long process.
So, sir, for our audience, I will do two things here. The very first thing which you explained about the US system, the Indian system, and the European system. European system was more of service rendered, and I think the clients or the people who are going to doctors, they are thinking that they are not negatively expropriated. So here, sir, you use the concept of information asymmetry. So for a patient and a doctor, they are two parties. First party, let's call it patient. Second party is the doctor. And here you rightly said the doctor has more information, that whether it is acidity, normal heart problem or heart attack, only doctor knows. Patient in India has to believe him, whatever he says. And somehow there are some black ships. Because of them, people think that doctor is negatively expropriating the patients and charging hefty money of heart attack where it was an acidity, and charging hefty money for saving him. And that is creating the problem. And sir, tell us one thing, that European system, if we have to implement, who pays for the medical services? Correct me if I am wrong, that they pay some social service charges, and medical and education, as you rightly suggested, they are included in that social service. Tell us about that model, sir.
So India already has that model. See, you have good public hospitals, medical colleges where you can actually access good healthcare for free. The problem is we have not kept pace with the explosive growth in our population, right? So if you go back to your father's generation, if I go back to my father's generation, did they go to a private hospital? No, they went to government hospitals. Yes. They were born in government hospitals.
We were born in government hospitals.
You were also born in a government hospital. They studied in government schools. I remember my sister, who's elder to me, was burned quite badly during Diwali, one time when she was very young. And she stayed in Safdarjung Hospital, which is a government hospital in Delhi, for almost 2 months in the burned ward. And she recovered and survived, and she's doing very well for herself. But now, in this day and age, you tell me who amongst us listening to this podcast or sitting in this room, the audience here, who amongst us will send our children to government schools or admit our young child in a government hospital for 2 months? Very few percentage. Why has this happened? Because we have allowed the government to step back and build private models around that. Okay, now you have money, you can access a private school, a private hospital, you don't need a government hospital. But we do need a government hospital. Everyone needs a government hospital. Why should the government not give good quality healthcare and education to each and every person in the country? I think it is our generation, yours and mine, who has allowed this, who have not asked the government tough questions in the late 80s, early 90s, early 2000s. Why are we not getting good quality healthcare? Because, people said, okay, we'll send the child to a private school only, or we'll get admitted in a private hospital only. At that time, if healthcare and education had been electoral issues, big electoral issues, the government would not have stepped back. But now I think it's changing again. We are seeing many new medical colleges open up. We are seeing some very good educational initiatives being done by the government, especially if you see in Delhi, there are very good government schools which have better results than most private schools. So things are again changing. I think people are getting aware, but this is something that we as a generation, you and me, have to take the blame on our heads, that we allowed the government this freedom to step back and say healthcare and education can be delivered privately at a fee-for-service model.
I think we will talk about, sir, resilience to the service and what makes a responsible patient, how a patient should behave, and who is a responsible patient, what is his responsibilities.
Oh, I think as patients, we have responsibility towards our health, right? We cannot say बहुत कॉमन वो है, but I'll repeat it. at the risk of sounding repetitive, but it's very common that people will eat street food which is full of oil, and then they will drink cold drinks and sugar laden energy drinks, and then come to a doctor and say, oh, I don't know why my BP is high, my sugar is high. And if a doctor prescribes a tablet, then question the doctor for 10 minutes that iska koi side effect to nahi hai, side effect to nahi hai. So we should realize that 80% of the cure of all diseases is in our kitchen and our playground. If we eat well and exercise well daily, most of the work of doctors will be completely gone. They'll disappear from the face of the earth. So we don't adopt a healthy lifestyle. That is the reason we fall sick. That is the reason we develop diseases, and these are called lifestyle diseases: diabetes, obesity, hypertension. So our first responsibility is to take care of our bodies and our brains, minds, because mental health is as important as physical health, if not more important. First. Second, we have to find one doctor at least who we trust completely, and then have an open conversation with the doctor. If you have some doubts, please do express it. Please do discuss what options you have, what are the treatment options being offered, what are the risks and rewards of each option transparently. But then, because as I said, the information asymmetry is so big, because that doctor has studied for 15-20 years, you have to finally at the end of it trust somebody to take that decision, right? And that doctor has to be that trustworthy doctor. So do find one doctor who you trust completely.
The family doctor can do that.
That is the best thing, because in India, again, because of this privatization, we've really fallen in love with this super specialist syndrome, that if we have a headache, we'll go to directly a neurologist to discuss. If we have a stomach ache, we'll go to a gastroenterologist. I think having a good family medicine, MD medicine doctor as your family physician, who can actually see you as a whole body instead of the blind man seeing the elephant as somebody rope or snake or pillars or a wall. If somebody can see you holistically and then decide whether you need a super specialist consult or not, and most importantly, and many scientific studies have shown this, that if you truly trust in the treatment being given to you, you actually have much better outcomes compared to placebo effect. It is very true. So if you do trust that this medicine will cure me, you will get cured. But if you say, no, I don't really understand what's going on and this is not really right for me, then your chance of getting cured go lower. So this is, I think, one of the most important things that all of us should do to ourselves.
Shuchin sir, in your answer, I like the point where you said that a responsive patient is one who is mindful of what he is eating outside in the streets. Yeah. And the answer of most of the problems are in the kitchen. Sir, with your permission, we will certainly do a second episode with you where we will talk about how to take care of yourself, how to be healthy, wealthy and wise using the nuksas given by our Dadi Amma's kitchen or Dadi Ma kitchen. That we will do, sir. That will be a separate podcast, sir.
Absolutely. Yeah. Your kitchen is your pharmacy. And most of the people I talk to, my patients, sometimes I do get busy in the practice. So usually I try and explain the diet very diligently, because that is, as I said, 80% of your cure. But most of the patients I tell just one thing, if it is in short, I say, kya khana hai, kya nahi khana hai. So I just tell them, ये बस खाते हुए देख लेना तुम्हारी दादी ये खाती थी कि नहीं. अगर तुम्हारी दादी खाती थी तो खा लो. और दादी नहीं खाती थी, तुम्हारी दादी ना तो बिस्किट खाती थी, ना छोले भटूरे खाती थी, ना कोल्ड ड्रिंक पीती थी. उसके टाइम में था ही नहीं वो चीज. So अगर तुम्हारी दादी वो खा लेती तो खा लो, सोचो मत ज्यादा. That is what I tell them.
Sir, they say even in Punjab now, लस्सी पीने से हमें सर्दी हो जाती है, and Coca-Cola is all right.
So sad, right? We are laughing about it, but it is actually very sad to hear this.
Yes, yes.
That a cold drink bottle, एक करछी चीनी होती है उसमें, not even चम्मच के हिसाब से, like a tablespoon worth of sugar. It is very sad that people are drinking cold drinks and all of this. It is very, very unhealthy for all of us.
This brings us to the final question of the session today, sir, and this is about helping the helpless. Sir, what you are doing, I have talked to you and known it completely, that you are helping the people who are at far-flung places. You are trying to help the helpless by accessibility and affordability of the medical services. But your task becomes difficult when the people who are there, they don't know how to choose. That brings me to the final question of the session, sir, that how to differentiate between glitz and glamour of big names in medical services vis-a-vis a local next door medical service provider.
Yeah, so you raised a very important point. I think that people don't really know a lot. And takes me back to a previous point that we had discussed, that the Indian healthcare story is built around scarcity. But then we see that hospital beds are vacant.
Yes.
So it is not just underserved. Healthcare is under-accessed also in our country. Our country has one of the lowest hospitalization rates in the world. It's not because we are the healthiest people in the world. It is because we don't know that this is something that needs, doctor or needs a hospital. So there was a study which showed that an LMIC country like ours, lower middle income country like ours, needs about 5,000 surgeries per 100,000 population per year. And this number is as high as around 23,000 per 100,000 in countries where awareness is very high and out-of-pocket expense is very low, like the Scandinavian countries. Even Brazil has a number of 13,000 per 100,000 per year. Now see in India how many surgeries happened last year. Only about 2.5 crore, maximum 3 crore surgeries, right? So for 1.5 billion people, this number is only what? 1,500, 1,800. Now where are the rest of the 3,200 people who needed a surgery? Where are they? They are in all our villages. So we hold this very structured program called Sehat Chopal, where we have been recognized for it all across the world. Even in G20, we were recognized as an Udharan on how to deliver community healthcare for the Sehat Chopals. So in the Sehat Chopal, we go village to village and hold awareness lectures about various diseases to the community, and then do screening for the entire village population and see what they are suffering from. So we see many patients like this regularly. There would be this old woman lying on the cot. They'll say, oh, she can't see, she can't walk because she's old. Now you have to educate them that, she has cataract. If you do a cataract surgery, she'll start seeing in 5 minutes. Her joints are gone. If you do a knee replacement, she'll start walking. So it is not that she is incurable. It is just they don't even know that these things can be easily cured. If you see, India has the largest number of preventable blind people in the world, and most of them are due to cataract. The cataract burden of India as of today, the people who need a cataract surgery and have not got it done is almost 8 crore people who are blind right now because they did not get their cataract surgery done. If you do a 5-minute surgery on them, they'll start seeing again, which is magical, right? So it is education, it is awareness that these people need. They don't even know that these things are available to them. If you can actually go to the village and tell them that you can actually get this done for free, and your life will be transformed. And it is not just one person's life. If you can't see, you actually need a full-time caretaker with you that will help you do the delay. So 2 people are stuck because you did not get a cataract surgery done, which could have been easily done in a very low cost. There are a lot of free organizations doing free cataract surgeries only if you know that you need to go to them, or if they can come to you, that will be the best thing. So we are trying to do that in the Sehat Chopals, that we go village to village, try and screen them, try and see what they need, and also make sure that we raise awareness enough that they don't fall to complications of other diseases, so that they take care of their health better. So this is something that's really deeply needed for the entire global south, not just India, but the entire global south needs this.
Thank you, sirs, for sharing your journey, your work, the purpose driven impact which you are creating. Respected audience, today we met a person who is having global impact, global values, but he is having the local values where he is going to create those impacts to our local villages. He can be easily in the best of the cities possible, but he is going to our villages and making a change there. With this, I urge everyone to support him in this cause. Thank you, sir. Thank you for doing the good work. Keep doing it, sir. Thank
Thank
you.
you so much, and thank you for giving me this chance to come and talk to your global audience. It is such a privilege for me, an amazing experience, and so lovely to talk to you. I hope we'll keep meeting again and again.
Thank you, sir.
Thank you so much.